Good evening. Thank you very much for the opportunity, and thank you all who have joined with me. Today I will discuss about the role of ultrasonic in endodontics. And before that, I want to start with a quote which is very favorite to me. That is, knowledge is of no use, no value unless you put it into practice. So I always encourage my fellow doctors and colleagues to start practicing. Uh, and I have started my presentations. I will start it very soon. But before that, who are watching my presentation, who are watching my presentation as an audience, please inform me whether the sound and the video and the screen which I have shared, you are seeing it very properly so that I can continue it. Okay. So today I will discuss about uh, the role of ultrasonic in endodontics. And today is a very special day for our country because today is 17 March, which is the birthday of our father of the nation, Bangabandhu Sheikh Mujibur Rahman. So I'm very much honored to participate in an event in this special day. So it is a very fortunate day for me, very lucky day for me. And this is my Bangladesh. This is a very beautiful country, and I welcome all of you who are listening my presentation from abroad. I welcome all of you to visit Bangladesh. We have different kind of seasons, different kind of weather, different kind of countryside, so you can visit all of the places, and I think you will enjoy it, enjoy your visit. So this is me, Dr. Atique Mehdi, and I have completed my graduation from Dhaka Dental College in 2010. And after that, I started my own practice, and I was very much interested to develop my practice. After in very training by in different manners. So in 2015, I got a chance to complete a leadership training in Sweden. I went to Sweden for the leadership training, and there I have got the YCF fellowship. In 2016, I was invited by the Royal Commonweal Society to attend the general meeting in 2018. And in 2019, I have completed my master's from Dhaka University on clinical social work. Now I'm doing my second master's on public health, and I'm working as a lecturer in City Dental College. So I always want to keep me updated in my practice. I always want to practice with the latest device, latest technology, and I always want to learn and want to make my colleagues learn about the new devices. So this is some moments, this is some photos of my lectures that I have delivered before, and from different places I am being honored from my lectures, and I always get appreciations from my colleagues and from my fellow doctors. So today I will talk about the scalar, and in the screen you are seeing a scalar which is named U6 LED. So this is one of the latest products of woodpecker. I am using it. It is a very elegant scalar, I must say. If we when that day I have kept it in my clinic, I feel that when I going to use it, patient has a different look on it. that is its look is very much elegant, and it has a touch panel, so that I can just if we want to bring any change, I can just touch it. So it is very much sophisticated, very much elegant, and very much effective, I must say. It has three options. That is, we can use it in general, we can use it in perio, and even we can use it in endo. So I always recommend these kinds of scalars to my students, to my doctors. So first of all, we have to know what is an ultrasonic scalar. Like in the when we are in dental college, like from the third year, we can go to clinical practices, and the first device we are being introduced, that is a scalar. So most of the time, that is what I can remember in Dhaka Dental College, I started with a hand scalar, and after that, when we are very much used to with the hand scalar, we are introduced with an ultrasonic scalar. So ultrasonic scalar is a modern device which we usually use to remove the calculus from a teeth, and it actually works with the vibration energy. And the way it uh, cleans the teeth, or the way it removes the calculus, is called uh, it is called a blast wave. That is, it creates a shock wave that disrupt the bacterial biofilm and the plaque. Then, and calculus can be flashed from the mouth, and uh, it also uh, what I can say, it also uh, gives a jet of water, which helps the calculus to flash out. And we all know that is in our mouth we have uh, gram negative bacteria. Mostly we have gram negative bacteria which always stay in inside our gums. So when there is a jet of water and bubbles of water, it disrupts inside the gum level. It creates an oxygenated environment, and which helps the doctors and the patients to disrupt the bacterial wall, to rupture the bacterial wall, and thus it helps the patient to have a bacteria-free gum and a healthy gingiva. So how do ultrasonic scalar works? There are two main types of ultrasonic scalar. One is piezoelectric and another is magneto strictive. So piezoelectric is the new technology and magnetostrictive is the old technology. Most of the magnetostrictive scalars use a elliptical motion, which is like a figure of 8, and in piezoelectric, it always brings with a linear motion. So vibration is very fast for both of the scalars. Like both of the scalars vibrate in 25,000 to 45,000 times per second, which is beyond our hearing limit. So we are saying it ultrasonic scalar, and it moves so quickly that it creates a Levez reaction. Levez, we always say, when we have seen, like when we have a blocked nose, we always use a syringe to push saline in one of the nostrils, and we get the deposition from another one. This is called Levez. So this type of procedure is done by the ultrasonic scalar, and even uh, as the water passes through the vibration tip, it creates millions of bubbles, and these kinds of effects is called cavitation. So the two effect, Levez and cavitation, helps the doctors or the operators to have the patient bacteria free teeth and a healthy gum. So in these slides, I have seen two kinds of process. That is, first one is the Levez process, and the second one is the cavitation process. Like you can see, water is coming, suddenly the pressure drops, and when the pressure drops, there is a bubbles or small bubbles. As the bubbles go forward, it expands, and after some time the bubbles blast and it release intense kinds of energy. So this is called the cavitation. It is a time frame for the ultrasonic scalar. Like the 1950, the first application for the ultrasonic scalar was introduced, and very interestingly, it was not just scaling. What we actually do today with the ultrasonic scalar, the first application of ultrasonic scalar was tooth preparation. But in 1960, it also it also started using in periodontal treatment. In 1980, the ultrasonic scalar was used for root canal instruments and disinfections. In 1990, this has been used in orthodontic treatment. In 2000, the ultrasonic scalar is used for periapical lesion diagnosis, and in 2010, this is used. The uses of ultrasonic scalar is become very vast in all the dental sectors. So today I will just discuss about the endodontic use of ultrasonic scalar. If we use the ultrasonic scalar in endodontic issues, then there will be some advantages, like what I have said before, that is water lavage is a great advantage for ultrasonic scalar. Even the ultrasonic scalar can rupture the bacterial cell wall, which is very much effective for the patient. Even it can remove the plaque from any tooth. So when we make a tooth plaque free, then there is a less chance of any kinds of infection or any further infection. Gram-negative bacteria most susceptible to lavage, because of when we create a lavage environment, there is cavitations and there is enough oxygen, which is very much harmful for the gram-negative bacteria, and these kinds of bacteria cannot stay in oxygenated environment. So ultrasonic scalars brings less trauma in soft tissues that compared to hand scalar, because when we use a hand scalar, there is much trauma in the soft tissue. So these kinds of scalar creates more comfort uh, rather than the hand scalar on any kind of device, and it has lessened the operator fatigue. Like when we use a hand scalar, we have to give a lot of effort to remove a calculus, and even this is very much hard for the patient to keep patience for a long time. Uh, this require less treatment time. When we use ultrasonic scalar, the treatment time is less, and even better, it is very much effective in going to deep and narrow pockets, and even in the percussion areas. So if we use ultrasonic scalar for any kind of pocket curate or any deep curate, then it gives an excellent result. Uh, and it reduces lateral pressure and less tissue detention. So these all are the advantages of ultrasonic scalar. Besides these advantages, it has some contraindications. Like we cannot use ultrasonic scalar in the patient who have pacemakers, especially the magnetostrictive scalars. But for the piezoelectric, most of the piezoelectric scalars devices have very little significance for the patients who have pacemakers. Another disadvantage of ultrasonic scalar is aerosol. uh, we have faced a lot of problem for aerosol in this pandemic, so we have to take a lot of precautions. We have to bought a lot of new devices to control aerosol in our clinic. So most of the aerosol is generated from ultrasonic scalar. which is very much what I can say, it's a contraindication, it's a side effect of ultrasonic scalar. There are some disadvantages of ultrasonic scalar. The most uh, uh, common disadvantages are uh, it decreased tactile sensitivity. Actually, I cannot say it decreased tactile sensitivity, rather than it becomes improved according to experience. Like ultrasonic scalar requires water evacuation. Without water, it becomes heated. So it is a disadvantages. So we have to use water to control the temperature. It creates lots of aerosol. So we need to take proper arrangement, proper devices, and proper protocols for the producing aerosols. It creates noise and vibrations. So sometimes it becomes annoying for the patients, and the patient become annoyed for the noise and the vibrations. And for some restorative materials, it is very much problematic, because of if we have a restoration in our teeth and we use ultrasonic scalar in that portion, the restoration can fall down. So it is very much problematic, and it is very difficult for sterilizing the handpiece. Sometimes some devices have handpieces which is made of plastics, so we cannot give it in autoclave. So it is very difficult to make it sanitize. There are two types of ultrasonic scalar. The first one, the white one, is magnetostrictive. This is a very common and very traditional scalar. And the last one is the black one, is piezoelectric, which is a new product from Woodpecker. So both of them can create a very high frequency, that is 20 to 42 kilohertz. And piezoelectric can create little bit better, little bit higher frequency, that is 9 to 50 kilohertz. And for the transducer, uh, the magnetostrictive has a metal rod, where the piezoelectric have ceramic. And the stroke pattern is very interesting. The magnetostrictive have elliptical stroke pattern, that is, it is what I say, it's like figure of 8. When we write 8, that kind of stroke pattern is created by magnetostrictive. And for piezoelectric, it is linear, it is very much linear. So it vibrate from forward to backward or side to side. So here is, this slide shows the uh, comparison between magnetostrictive and piezoelectric. So what I say, piezoelectric is the modern technology, and it creates less vibration, it takes less energy, and it produces more efficacy than the magnetostrictive. So we can use uh, piezoelectric in our day practice. Before starting the use of ultrasonic, when I was reading the research paper, one thing uh, just amused me. What is, nowadays we all using ultrasonic scalar as the device for scaling, as the device for plaque removal. But the main use uh, started with the was the use of making cavity. Like the first use of ultrasonic scalar was using it as making cavity. So the first introduction, when we got the ultrasonic scalar, it has been used as to make cavity. It has some slurry instruments, slurry inserts, which has been used to make these kinds of cavity in tooth. So there was different kinds of bars, different kinds of inserts to make the cavity, half ball, half diamond, and half full diamond tip. But in 1955, Jenner reported that these kinds of ultrasonic scaler can be used to remove plaque from the teeth. So that time, this is widely used in our dentistry to remove the plaque from the teeth. So the first use of ultrasonic scaler started in 1955 as a plaque removal device in dentistry. In 1957, Richman gives a new identity for the ultrasonic scaler, which is we can use this ultrasonic scaler in endodontic treatment. Uh, we can use it in different manners, like we can use it in excess preparation, we can use it in orifice location, even in irrigation, which is very much effective in irrigation. We can use it in sealer placement, gutta percha obturation, MTA placement, like different types of things. And even if we have a metal post or fiber post in our teeth which we need to remove, we can use the ultrasonic scaler. And the most common thing is we all are having pulp stone in our daily practice. When we open a tooth for root canal treatment, we see a pulp is very hard and it has become stone like. So we can remove this pulp stone with the help of ultrasonic scaler. If we just classify the clinical uses of ultrasonic scaler, we can have three different parts. Like in pulp chamber, we can use it as excess refinement, we can use it as finding calcified canal, or removing pulp stones. In the middle portion, we can use it to remove any kinds of separated instruments. We can use for a root canal post, removing any root canal post, either it could be metal post, it could be fiber post, and even we can use it placing any MTA. In the apical portion, we can use this ultrasonic scaler for surgical endodontics to remove any abscess or cyst, to do epicectomy, any kinds of surgical procedures. These slides show what is the how the looks differ when we prepare excess cavity with bar. That is, picture 1 is showing excess cavity prepared with bar, and the picture 2 is showing excess cavity prepared with ultrasonic scaler. So we can see the preparation with the ultrasonic scaler is more fine, more accurate. It takes time, but it is more accurate. So from this slide, we can come to a point of which is better, ultrasonic scaler or diamond bar, high-speed diamond bar, which is better. So obviously, the high-speed diamond bar is decreasing our preparation time. Ultrasonic scaler is have it takes a long time to prepare a cavity, but still ultrasonic scaler gives us the accuracy. So as Dr. Stephen says, any clinician who performs molar endodontics without ultrasonic is working too hard, is experiencing more anxiety than is necessary, and is most likely not finding MB2 canals in more than 40% of their maxillary molar cases. So if we use ultrasonic tips in our practice, there is a high chance of having MB2 canals in molar teeth. We can use ultrasonic scaler in cavity preparation. Like there are lots of different bars, different inserts for the ultrasonic scaler for cavity preparation, and this is very much effective compared to diamond bar because it creates less vibration, it creates less noise and less heat because there is always a water flow in the ultrasonic machine, and sometimes it doesn't need any local anesthetics to prepare any cavity. So it is more effective than the uh, traditional bar that we are using. And this is the regular use of ultrasonic scaler, what we are using in our daily practice, that is to remove plaque from the teeth, remove stain, for deep curettes, for removing any gingival deposits, any gingival disease, gingivitis, periodontitis, any kinds of things. So which is very much important use. This is another interesting use of ultrasonic scaler. It has some K-type files, and for preparation any endodontic teeth, any tooth which is having root canal treatment, K files is very much effective, and we can use these kinds of K files with our ultrasonic machine. And to attach these K files, we have different kinds of inserts. Like this is called scalar endotip. Like there are three kinds of endotip. One is 180-degree angle, one is 120-degree angle holder, and another is 90-degree angle holder. We can just have these kinds of angle holder and attach these K-type files with this endotip and use it in root canal procedure. Irrigation is the most important thing for root canal procedure, and this kinds of irrigation is like very much easy if we use ultrasonic scaler. Okay, if we use the vibration of ultrasonic scaler for irrigation, it creates a passive irrigation effect, like this, which I have said, but which we said passive ultrasonic irrigation, which is PUI. There is two type of ultrasonic irrigation. One is active ultrasonic irrigation and another is passive ultrasonic irrigation. Active irrigation is we are flowing water, or we are flowing any kinds of irrigants from the ultrasonic machine, and it is put directly in the tooth, and the vibration of the tip is given, and it creates a vibratory motion inside the tooth. And the passive ultrasonic irrigation is we will give the irrigant first, and then we will put the vibratory tip in the irrigant, and it will create a vibratory motion, which I have said acoustic streaming, and sometimes it creates cavitation inside the teeth, inside the root canal, and it removes all the bacteria, all the pulp tissues, all the necrotic tissues from the canal. So acoustic streaming and cavitation usually remove all the bacteria and microorganism from the canal, and with these tips we can also remove the smear layer from the root canal treatment. And one research have shown that passive ultrasonic irrigation is more effective than the other procedures, like we are using self-adjusting file, we are using positive apical pressure, we are using endo finishers, but the ultrasonic irrigation is more effective. It is what they have said, this is 94.1% effective, where the other procedures have not more than 89%. So we can easily use ultrasonic irrigation in our daily practice, which is more effective than the others procedures. Here I have put a video. This video I have taken from a website. This is not done by me, but I am showing you the video for learning purpose. You can see the irrigation procedure. Okay. So again, use of ultrasonic scaler is we can use it for removing any kinds of metal post. Like if we have, if we go for any retreatment, then we can use ultrasonic scaler to remove any metal post, any remaining metal post. So ultrasonic scaler made very much easy because it creates a vibration to the metal, and we can easily remove the metal post. Even we can use the ultrasonic scaler for gutta percha obturation, because of if we just vibrates our tips, it become heated, it raises temperature. That temperature is used for obturating the gutta percha in the root canal, which I am using in my clinic, which is very much effective. You can also use it in your practice, and you will find it very much effective. In surgical endodontics, we can use the different kinds of inserts of ultrasonic scalers. Like if we want to do any kinds of episectomy, or any we want to remove any kinds of tooth abscess, apical abscess, then we can use the surgical tips of ultrasonic scalers. Even some scalers come with the piezotomes, which is a very effective inserts for cutting the bones. So if we need to open any window from the bone to remove any apical abscess, then we can use the piezotomes, and it can be used any kinds of the modern types of ultrasonic scalers to cut the bone for the surgery. So this is a photo of removing coronal stones, pulp stones, with the ultrasonic scaler. And in this slice, I have inserted a video which is showing that how to remove a metal post from ultrasonic scaler. Still, I have collected the video from internet. So we have seen that we can easily remove any kinds of metal post with the help of ultrasonic scaler. It takes only 2 or 3 minutes. So I didn't make the didn't make the video faster. So the video is length is 2 minutes. So in 2 or 3 minutes we can easily remove any metal post. This is a photo of a pulp stone, which is removed with the help of ultrasonic scaler. So still I have taken these photos from internet. This is a long pulp stone which has been removed from the with the use of ultrasonic scaler. There is another video I can show you. This is just 1 minute video. So the use of ultrasonic scaler is really very much uh, interesting if we can use it properly. We always take a lot of trouble removing the broken instruments from the canal. So we have seen that it's very easy for the ultrasonic tips, endo tips, to remove any kinds of broken instruments from the canal. Just we need to know how to use these kinds of tips. So to make our life easy, to make our practice easy, Woodpecker has brought 6 endo tips for the ultrasonic scaler, which they have named is Dr. Talal's endo kit. So I will just introduce you with these kinds of tips. That is what the tips are doing, what is they are for. There are 6 tips, and they have named it T1 to T6. And the T1 tips is which they are calling T1 ultrasonic tips. It is used to uh, remove the calcification from any canal orifice. And this tip can be bended, and it can direct it to the drill accurately. And these tips also can be used to remove any kinds of gata parcha, what you have seen in the pictures, that is they have removed the gata parcha with the help of these kinds of tips. And these tips also can help us to remove any kinds of fiber post which is seated in apically, and even we can use these kinds of tips to remove any kinds of paste, any kinds of sealer paste in the case of retreatment. Second come the T2 tips, which is mainly helps us in irrigation activation, and even we can use it cleaning any kinds of canal walls. We already have seen a video how we can use these kinds of tips in irrigation. So T2 tips is very much effective in irrigation activation. It is also a flexible tips. T3 tips, this is the uh, uh, excess cavity opening and refinement tips. Like when we go for a filling, or when we go for a root canal excess cavity preparation, then we can use these kinds of tip for excess cavity preparation. Even we can use these kinds of tips for any exploring any kinds of hidden canal. Like if we want to have mesiobuccal 2 in our practice, then we can use these kinds of tips. If we have any kinds of calcification in the pulp chamber, we can use T3 tips to remove that calcification calcification, and this tips is very much effective in removing any kinds of metal post from the tooth. T4 tips. This is the pulp stone removal tips. Like in our practice, we always finds uh, tooths which has developed pulp stone, and even we struggle a lot in our daily practice to remove that kinds of stone, and sometimes we cannot determine whether we have removed it fully, or we have just hitting our files blindly in the cavity. So we can use these kinds of T4 tips for pulp stone removal, and even it helps us for cleaning the percussions, uh, and making the orifice, canal orifice, visible to us. And even this, we can use these tips for base material removal. And if we have GP in the chamber, in the pulp chamber, in the coronal area, then we can use these tips for GP removal. T5, it is the fiber post removal tips, and these kinds of tips can be helped to remove fiber post coronally, and uh, it can penetrate in the middle of the circumferential. So if we have any exudates in the fiber post, we can introduce these kinds of tips in that area, and even these kinds of tips can be help to remove any kinds of resin cements remnants when the whether we go for any kinds of retreatment. Even these tips T5 can be used for any canal walls, and it is very much effective in any retreatment cases. This is the last tips, that is T6. T6 is used to explore, to uh, like find any kinds of broken files, and if we have any fiber post which is situated apically, we can use these kinds of T6 tips to remove any kind of fiber post for retreatment. And if we can remove these broken files or fiber post from that area, we can easily have a good retreatment case. We can make the retreatment successful. So this is all my presentations, and thanks for your attention. And if you have any question, you can write me. I will have I will accept any kinds of questions, any kinds of feedback, and any kinds of suggestion how I can improve my presentations. Or if you have any further note, you can just write me in my email. So thank you so much for your patience. If you have any question, you can write me. I will accept any kinds of questions. Okay, we got a question from Mr. Zaman. He's asking which tips is most effective for broken file retrieval and management of calcified canal. Like for if we use Dr. Talal's endo kit, then we can use the T6 for a broken file removal if the broken file is in the apical portion, and for the calcified canal, we can use T4, and even we can use T4 is mostly effective for calcified canal, and if the calcification is in the orifice, then we can use T1. I think you have got your answers, and I'll request you to use the 6 tips, and You can use it with U6, the scalar, and you will just feel that what changes it has bring in these tips. So if we have any question, we can answer it. Seems that there is no more questions. So I will the video will be in our page. You will see the recorded video in any time. If you have any question, you can write me. I will try to answer after the video has finished. So thank you for your patience and thank you for listening. Have a good night. Bye bye. Okay, just when we going to end, we have another question from Arifur Rahman Pranto. Okay, thanks for the presentations. Thank you so much for listening. Sir, is there any chance of having perforation? Okay, the chance of perforating any tooth or canal surface is very low. And if we compared it with the diamond bar, the chance of perforation is almost near to zero. So if we can handle the scalar with the proper procedure, then there is less chance of perforation, but there is a chance of fracture because of the vibration. So we have to be skilled with the scalar, and we have to always have an eye with the vibration, always have to control the vibration so that uh, there is no fracture in the tooth surface. So thank you so much for your questions, and uh, I will be very happy if you have more questions, and you can write me in my email, or you can write me just below the comments in this video. I will try to answer. Thank you for your patience, and good night. Bye bye.